Hello, my name is Dr. Sakina Bajwala. I'm a board-certified allergist and immunologist and a fellow of the American Academy of Allergy, Asthma, and Immunology. My patients often ask me if food allergies can cause reflux or heartburn. In general, most acid reflux disease is not caused by food allergy and doesn't require food allergy testing. However, if you've been experiencing heartburn, vomiting, abdominal pain, a sensation of food getting stuck in your throat, or difficulty swallowing, and these symptoms have not responded to standard anti-reflux treatment, such as a proton pump inhibitor medication, your symptoms may be a sign of a condition known as eosinophilic esophagitis, more commonly known as EOE. EOE is an allergic inflammatory condition of the esophagus or food pipe, which can often be triggered by food allergies. In EOE, white blood cells known as eosinophils accumulate in the lining of the esophagus in response to exposure to food or even environmental allergens. The ensuing inflammation causes the distressing symptoms that I mentioned earlier. Although your symptoms may suggest EOE, confirming the diagnosis will require endoscopy and biopsy. Endoscopy is when a gastroenterologist looks at the inside of your esophagus with a camera, and biopsy involves taking a small sample of the tissue of the lining of the esophagus and examining it under a microscope for the presence of eosinophils. If the diagnosis of EOE is confirmed, your treatment will likely include a combination of anti-inflammatory management, such as an inhaled steroid medication, and food allergen avoidance. Food allergen avoidance can be accomplished in one of two ways, either with an empiric elimination diet or with targeted dietary elimination. An elimination diet involves removing the most common food allergens from your diet and then slowly reintroducing them over time once your symptoms improve. In EOE, the most common food triggers include milk, egg, soy, wheat, peanut, tree nuts, seafood, and meats. As I mentioned earlier, an alternative strategy includes targeted dietary avoidance. This involves skin testing with either prick testing or a combination of prick and patch testing to selected foods, and elimination of those foods that test positive. This sort of testing can be done under the supervision of your board-certified allergist. It's important not to let the symptoms of EOE go unchecked, because long-term complications can include tightening, strictures, or even tearing of the esophagus. Therefore, if your symptoms are not responding to standard therapy, or you believe that your symptoms might be more than just simple heartburn, talk to your allergist. With the right combination of anti-inflammatory and dietary management, the symptoms of EOE can be significantly reduced, allowing you to lead a full and active life.